Okay, so we're starting at duty area 4. This is going to be consisting of administration of prepared installations and treatment. What does that to you? What does it mean? Administration of prepared installations and treatments.
Giving out or taking something that's in your possession and giving it to a resident. In this case, medicine mostly. So like,
Well, no. Eye drops. Something that's already there, and it's you just got to administer it. So kind of like eye drops in inhaler. It's already there. We just have to administer it. 2 puffs. It's already everything's fixed on it. They just got to administer it. You know. So that's what they're talking about: prepared installations and treatments. And I apologize for this, but these slideshows are messed up a little bit. This one is talking about, this one actually skips back to 3.7. So I apologize, but it is a quick note that we do need to hit. If you have medications, and let's say somebody turns them into you at the nurse's desk and it's something we picked up from the pharmacy, never ever leave that medication just sitting out of your sight. Never. And we talked about never using a contaminated pill, and we talked about the real life of it. Never touch pills with your hands. Always wear gloves. Always. We're in the middle of a pandemic for one, and for two, it is something essentially going into somebody's mouth. So be very clean about it. Wash your hands. If you have to hit your nose or pick something out of your teeth, go do that in the bathroom. Wash your hands, put gloves on, and then finish your mouth. Liquid meds. So has anybody ever took a chemistry class? Yes, took some kind of science or something, I'm sure, even in high school. When they said to measure a liquid, they probably said put it on the table and look at it eye level, or hold it up and look at it eye level. They preferred the table, but eye level is where you want to look at medications that are liquid. Why? Because when you pour medication, it's like a liquid in chemistry class, it has something called a meniscus, right? So if you look at when a liquid is poured, it will actually start here and bevel down and go back up. If you look at something that's poured into a little tube or something. So you want to measure from the bottom of that bevel. So that's where you would measure medications at too. So always look at it eye level and document when you pull medications. Now, if the client questions a color or size, don't give it, or go back and look at the medications and let them look at them too. Be totally transparent with them and give them a glass of water. Some people I have say, I don't need water, and they'll just swallow it with nothing. And how they do that, I don't know, and it's a choking hazard. They need water, and it also helps with the digestion of the medications. So also, would you pour, before we get started in the 4, I'm sorry, backtrack a little.
I have a question.
Ask me.
So you mentioned water helping them digest. So what about something that says like eat with food or take with?
Yeah.
We may get to that at some point.
And you will, especially here, a lot of the medications, antibiotics, and stuff like that will say eat with food. So that's why we have our med times too while they are. Because what they could do is they can eat a lunch or eat a dinner or eat a breakfast and then come take their medicine because there's still that time limit to do it. Now at nighttime where there's no meal served, they could have even when it means eat with food, that could be a pack of nabs a slice of toast or something, you know, something to help with. Most of the time when it's eat with food, it helps keep from having gastric upset. Because whenever they don't eat with food and they take it on an empty stomach, most of the time they're going to vomit after that. It irritates the mucosal lining of the stomach. So, and one more thing before we get to duty area 4, would it be okay for Joey, for you to go back to the med room and get all the medications ready, and then let Jordan give them out? No. Why? Yes, you're the one responsible. You got them out. Now, Jordan, if you do that, let's just say you do it. No, you're not supposed to, but you do it anyway. What could potentially happen?
Become liable for my mistakes. That's right.
Or you're going to be liable for his mistakes. Either way, because what if Joey's back there and he gives out, he puts a cup full of medications into this guy's little bin, okay? And he accidentally packs up his nighttime meds, and you're giving it out at 8:30 in the morning. And you just reach this guy a couple pills, and he does not look at them. And he just swallows them. Well, there is a mistake because, for one, if we don't catch it, then they're going to be giving them again at night. So they will be double dosing him. And then for 2, it's a med error because of the fact it was given at the wrong time. So it could be when you're doing something and you want to make sure it's done right, you usually do it yourself, right? So be responsible, make sure you're doing that. Don't trust someone else's word. I'm not saying to be mistrusting everyone, but something this serious and this meticulous, I wouldn't want to leave up to someone else with my name on it. It's a legality. Yeah. And know it's done right. Or if you make a mistake, it's your mistake. So I mean, I wouldn't want to be paying the price for Jordan's mistake, giving out medication and letting somebody ingest it into their body and potentially harming them for his mistake. And I'm not saying that you can't make mistakes because you're human, but let it be your mistake. You know? So, moving on to duty area 4. Sorry, we got off on a bit of a tangent there. So duty area 4, we're going to be discussing prepared installations and treatments. So there's routes of administration is going to be eye, ear, nose, oral, topical, transdermal, inhalation products, rectally, vaginally, or an EpiPen. That is most of all the ways that anybody's ever going to get medications, besides injection. Now, I think that's not on there because of the fact you guys don't give out injections besides the insulin. It's not a dumb question. No question is a dumb question. Transdermal is something that's going to be across the dermal area. So trans is across the dermal skin, right? So we're going to be saying that's a nicotine patch or that's a lidocaine patch. So that's going to be considered transdermal medication.
Topical, like usually goes on your skin, it's usually like cream or ointment.
Mm-hmm. Yep. Okay. So this is going to be a whole lot of talking. The slideshow is kind of really short on this one. So So assisting the client with a soak and a sitz bath. Have you guys ever heard of a sitz bath? No. Any of you guys have children? You heard of a sitz bath, Tracy?
Yeah, I actually have.
Okay. And most women have, and some men that have children uh, uh, with their wife has heard of it. Um, because most of the time it is done after labor, but it can be used for other issues too. A sitz bath um, is not only for the perineum after giving birth, um, it could be an arm or a foot. Um, basically, um, I mean, we'll go over the logistics of it here in just a little bit, but basically, it's going to be a warm, tepid um, submersion of that body part. So, but we'll go over it. I just some guys have never heard of it. That's why I have males in the classroom. I'll always try to just hit it real quick. We'll go over it in depth here in just a second. So, eye drops. Um, have you? I'm sure all of you probably use an eye drop at some point. Um, here is the correct steps you will take to administer an eye drop. So first off, you're going to wash your hands. And you must wear gloves because you're touching a patient and you're touching medication. You can use a mirror or get assistance from another staff member. Check the dropper for patency for eye drops. That's just kind of squeezing it and make sure that the top is open so the drops will come out. If air will move in and out, then the liquid will too. So what you're going to do is hold the dropper tip down. Do not let the dropper touch anything. And before that, if it's indicated, and I know some antibiotic eye drops are, to shake them. And most of them, like, if you gotta shake them, they're pretty thick. You gotta shake them pretty good. Tell the client to lie down or tilt the head back. And then use the index finger to pull the lower lid down to form a pocket. Place the dropper or dispenser as close to the eye as possible without touching it. So do not ever let that dropper touch the actual eyeball, because that's risk of infection, risk of damage to the eye. Brace remaining fingers around against the cheek. And you're going to drop the prescribed amount into the pocket made by the lower lid. So replace the cap after that. Do not rinse or wipe off that tip, because that is just putting germs on. Press finger against the inner corner of the eye 1 minute to prevent medication from entering the tear duct. So, and then close eye, tell them to close eye gently and wipe off excess with a tissue. So, and then wash hands to remove medicine and complete appropriate documentation. So, if you have two different eye drops, and sometimes they will, especially with an eye surgery, and we do have people here that get eye surgery sometimes because it's an outpatient basis, you're going to do one drop, wait 5 minutes, and do the next drop. So, now, I'm going to demonstrate how to pull the eye down. So what you're going to do is you're going to brace the head, okay? Tell them to pull the head back, lie down. This is, I'm going to be standing up for demonstration purposes. So I always take this finger and I pull down the lid, and that makes a pocket. So I take their other fingers and I brace it against the cheek and their head. See this finger here? It's going to the tear duct. I'm holding the tear duct because when that is open, the medication is meant to rinse the eyeball. So if it's not rinsing the eyeball, it's not doing its job. If it goes into your tear duct, basically it's either going to run out your nose or go to your mucus. So that is the main reason to hold the tear duct in for 1 minute. It allows it to rinse the eye. And then, so I'm administering the medication here to the eye. I've administered it, it's in that pocket, and I can let go of the pocket and let them blink gently while I'm holding this. That keeps the medication washing over the eye. Okay? So then after 1 minute, I can let go. I'm going to give them a napkin, and so you can wipe your face now because most of the time it's going to start draining out. But it had a chance to wash the eye. So, any questions on that?
Yeah, I guess I've done that one. So most of the time, people are pretty particular with their eyes. I know I kind of am. I would want to put in my own eye drops. What's
Yes.
the deal? Is that just for on request when people do ask for you to do it for them, or?
Yeah, you can always oversight when somebody wants to put in their own eye drop. The best thing to do is proper teaching before they do it, because I'm going to tell you that most people don't know the proper teaching when administering eye drops.
You put it right into the tear duct.
Yeah,
Put it in there, let it run down the eye. That's what I guess that's wrong.
Literally just like this, just drop it in.
just drop it, yeah. And that's okay, but you're not letting the medication be effective as it can be. Because it's not sitting there. It's just absorbing right into that tear duct. It's basically when you have a liquid somewhere that it doesn't belong, it's going to look for the fastest way out, like blood does. And the fastest way out of that eyeball is going to be through your tear duct. So it's just going to drain right down in there, and your tear ducts actually are connected inside of your mucus system inside of your nose. Tears are just watered down mucus. It's just going to go right in there. So, eye ointment. Basically, it is the same thing, except when you tilt the head back and you've got this pulled down into a pocket, you're going to put a 1/3 inch strip of ointment into that pocket. So it's basically going to go from the inner to the outer. So I always do things from inner to outer, from clean to dirty. So you're not going to let the tip of that ointment touch inside of that pocket. You're going to let the ointment go into that pocket. Okay? And then you do not have to, I'm sorry. You do not have to hold the tear duct on an ointment. Basically, the ointment, have you guys ever had Vaseline in your hand? Or like a jelly, like a petroleum jelly like that? Basically, when it gets warm, what's it start to do?
Slimier and things out.
Starts to lose its consistency of being a gel or a cream to more of a liquid. It's going to happen in your eye. Your eye's quite warm right there, so it's going to happen right there, and it's going to allow it to start coating the eye. So it's actually probably not going to turn into a full liquid. It's going to be more of a slip gel. So it will coat the eye, and you don't have to hold that tear duct. Any questions? Okay, we're gonna move on to the next thing. Okay, we're starting back with duty area 4.2. So we're gonna be talking about eardrops. So we're gonna be assisting the client or resident to administer eardrops. Again, now this may be one of those deals to where they want to do it themselves, but proper teaching and oversight's good on those things. So you're gonna wash your hands and wear your gloves. You know you're touching the patient and medication. So you're gonna check the dropper for patency. How are we gonna do that? We're just gonna squeeze it a little bit and make sure that it does have it's moving to come out. Avoid letting the dropper touch anything. Now, if it's some that is in the fridge or it's been cold, you can warm the bottle in your hand. Just hold it like that. About 60 seconds until warm. Check the drops if they're cloudy. Some of the medications and eardrops and eye drops too will settle at the bottom and it will become like a cloudy looking. And you want to shake it up until it's more of a opaque, like a white look. Not cloudy, but just a solid white, milky looking. So, and a lot of eardrops will have the little droppers. You know how you, some of them are like eye drops that come with that little plastic. But some of them are like a bottle that has like a squeeze dropper on top of it. So what you want to do is draw up the prescribed amount into that dropper. Sometimes the dropper will have a line on it or a few lines where you're supposed to go to. Okay, tilt the affected ear up or lie on that side. So a lot of times our guys will sit in the chair and they'll do like this. If you want to have them lie down, if this is your person, you would, and this side is their ear, you want to make sure they're lying on that side that you're going to be administering with the ear facing up towards the ceiling. Do not insert the dropper all the way into the ear, just above it. So keep the ear tilted back for a few minutes or insert a soft cotton ball into the outer ear. Have you ever seen people with cotton in their ears? Most time they put in an eardrop. It's best to let them stay over for a few minutes and then insert the cotton ball because it's letting that medication set in the ear or coat the eardrum. And then after a few minutes after that, they can take out the cotton ball. Wash hands to remove the medicine and complete appropriate documentation. Any questions on that? Now, some eardrops, while we're talking about them, I know we talked about Ceruminous or Debrox earlier in the class. That medication is actually will have directions and it will tell you how long that needs to set in the ear. So really the cotton ball is not going to help you in a situation like that because it needs to be down in there with the wax. What it does is it starts to break down and loosen the wax in order for it to either be flushed out or pulled out with the tool that's provided in that medication. So just make sure you're reading your directions well. Read. So any questions on that? All right, we're going to move on to the next. Okay, nasal drops. Okay, so you're going to ask the client or resident to blow their nose gently. And then you're going to wash your hands, of course, and you're going to put on gloves because you're touching the patient and you're touching medication. This says if the client has an infection or bleeding nose, put on gloves. But you're touching medicine and you're touching them, put on gloves. And you're right there at the nose on the gloves. Check the dropper for patency. Do not let the dropper touch anything. Draw the medicine up into the dropper, like the eardrops I was telling you about. Tilt the head back while standing or sitting, or lie down and hang the head over the side of the bed. So essentially, they want their head back pretty far like this. That way it can go back in there. Okay. So place the prescribed number of drops into the nose. Replace the cap promptly and wash hands to remove the medicine and complete documentation. Now, nasal sprays are a little bit different. Those were drops. This is sprays. You're just going to ask the person to blow their nose gently with the head upright, spray the medicine into each nostril. And while you spray it or while they spray it, tell them to sniff briskly, like, you know. So briskly and firmly. Spray once or twice into each nostril and wait 3 to 5 minutes. Then they may blow their nose gently and repeat the steps if necessary and prescribed. Any questions there? Now, I will say this while we're on nose drops. Some nose drops can cause nosebleeds because nose drops, most of the time, are, not nose drops, but nose sprays, are mostly indicated to dry up secretions because they have stuffy nose, allergies. So something like Flonase, if you guys heard of that, sell it at Walmart. If you use it over the allotted amount of time, which I think is 5 or 7 days, you'd have to review the instructions, even for yourself at home. It can cause what they call rebound congestion. And what it is your body is trying to compensate for actually drying out too much. So if it dries out too much, then the mucous membranes say, oh, I'm going to just produce more. So you're actually going to get more congestion. And then you're going to have to use the nose spray more to get rid of that. So essentially, your nose becomes addicted to the nose spray. Have you guys ever met anybody addicted to nose spray?
I was a respiratory therapist, and they told me that. They told me that nose sprays are actually worse for you because you get a reliance on it and kind of yourself.
Yeah. And I knew a guy one time, you can get these little things in the store that look like almost like a little torpedo, probably about that small or something. And they're put out by Vicks and different things. And it's a little chunk of medicine. It's like an aroma medicine. When you put it up your nose, you go, hold one time, you go like that. And it sucks that up in there. And I knew a guy that was addicted to those things for years. And you would see him all the time. He'd smoke cigarettes, and then he'd smoke a cigarette, and then come in and go, have to inhale that thing. And it took him like, I don't know, I think he used them for like 5 or 6 years before he ever quit using them. But he got terrible headaches going off of it, nose problems, he was having congestion issues. He had to retrain his body, so his nose and mucous membranes were addicted to that. So it happens. Our nose can be addicted to something that we can't get rid of. Pictures in this book are copyrighted from 1997 if you want to know. Those are some old ones, ain't they? So the next one is 4.4, and it is administering topical medications. So now you would think that's not a bad thing, it wouldn't be hard to do, but it can be dangerous. So you're going to wash your hands and always wear gloves. A topical medication to skin that is weeping or has open sores, wear gloves. If you're going to be putting on any kind of ointment, wear gloves. Apply a thin film of cream, ointment, or lotion to the affected area. Do not cover it with a bandage unless directed by a doctor, and we'll talk about why not to. Replace the container top promptly and wash your hands to remove any medicine immediately and complete documentation. Now, why would we not want to cover something up that has ointment? You guys ever put on antibiotic ointment and then put a Band-Aid on it? It just stays there, right? It's real mucky and moist, and it doesn't let it absorb properly because there's not enough air getting to it. And potentially, what can happen is that can mess with the strength of the medication. So you would never want to take cling wrap or plastic wrap or Band-Aids and cover up ointments unless it's directed to do so. Now, another topical medication that is dangerous is nitroglycerin. Have you guys heard of that? So that's when somebody takes if they have had a heart attack in the past. Sometimes they get a nitroglycerin cream, and that can be put on. The thing of it is it will come with a measuring tape, and it will say put on 2 inches of this cream. So you'll put the measuring tape on, you'll go down 2 inches with the trail of that cream. And that's what their prescribed amount is. Now, what does nitroglycerin do? No, I think they talked about it in CPR yesterday. It dilates blood vessels, so it makes them bigger. So people that's had a heart attack has most of the time got a lot of buildup plaque and blockages in their blood vessels. So when they start having chest pains and they get that aching feeling and their lactic acid level starts building up in the muscle, they're like, oh, that's hurting so bad. They take that medicine and it opens up the blood vessels, like it makes the water hose bigger. So then that way blood can be pumped more efficiently and easier through the body, and it's not straining the heart as bad. Now, here's the thing. If I'm putting it on somebody and I'm not wearing gloves, what's it doing to the patient?
It's absorbing into your fingers too.
Yeah. So if it's causing them to have vasodilation because of chest pain, what's it going to do to you? The same thing. So now, if you're putting on a hormone, they have hormonal creams. I'm sure you know that. Sometimes they have men hormone creams like testosterone cream. Sometimes they have different creams for women to help with pregnancy or menstrual cycles or things like that when the hormones are off. They'll say put this hormone cream on a different area of your body. If they have that and it's messing with their hormones and you get it on you, it's messing with your hormones. And if they put it on themselves, that's okay too, but they need to wash their hands thoroughly because whoever they touch is going to be getting that medication again too. So if I'm putting on a bunch of testosterone cream and me and Tracy, not that we would, but walk to lunch every day and we hold hands at the Pizza Hut. She's getting a big dose of testosterone every day that we're doing that. So you got to think about that even with children. How many times are parents holding their children's hands? You hold your children's hands when you go to the store, Tracy? Walking across the road?
Uh-huh.
So if you've got a hormone on your hands from a cream, you're potentially giving it to your kids, and it can cause them issues. There's a House episode like that.
Assisting clients and residents with administering compresses and dressings. The steps to follow in applying compresses and dressings are wash hands. This is a step that you can tell we follow every time. It's important to wash your hands. Wear gloves if assisting a client or a resident to apply the dressings to an open wound. You don't want to get the bacteria or any contaminations into your hands or into your own body, so it's important to wear those gloves. Follow the doctor's orders for preparing a compress solution. That step's fairly self-explanatory. Keep the compress in the gauze pads or washcloths clean. Soak the compress in prepared solution and squeeze it tightly. This is an important step. Apply the compress to the affected area following the doctor's orders. If applying a cold compress, keep the compress cold by changing it every 2 to 3 minutes, or applying plastic over the compress and then an ice bag. Check the area frequently for blueness or paleness. If applying a warm compress, check the temperature of the compress solution, making sure the temperature is correct according to the doctor's orders. Reheat that compress and dip it into the solution again. Check the area frequently for redness, warmth, and the warmth of the compress. You don't want to burn the resident or client or cause any worsening damage, so it's very important to frequently check back and make sure that things are progressing according to normal. Keep the dressing from touching anything. This is to keep germs from getting into the wound, which would be covered by the dressing. Apply the dressing according to the doctor's orders. Dispose of the compress and dressing material according to facility procedure. Wash your hands and assist the client resident in applying the compress or dressing. And finally, make sure to document the experience, as is the case with any handling of a client or resident's medication or medication administration. The next bullet, we're going to jump to task 4.6. So this is assisting with the administration of rectal and vaginal products. Steps in using rectal products, suppositories, creams, ointments, and enemas. First, you got to wash your hands. If the medication aid assists the client or the resident in inserting the rectal product, gloves should be worn. Suppositories. If suppository is too soft to insert, please place it in the refrigerator for up to 30 minutes or run cold water over it before removing the wrapper. Then you'll remove the foil wrapper. Moisten the suppository with water or with KY jelly. Make sure to have the client or resident lie down on their left side and push the suppository well up into the rectum with the finger. Insert the suppository up to the second knuckle of the finger. For creams and ointments, bathe and dry the rectal area. Have the client or resident lie on their side and apply a small amount of cream, ointment, and rub in gently. If the doctor orders call for inserting the cream or ointment into the rectum, attach the plastic applicator tip onto the open tube. Insert the applicator tip into the rectum and gently squeeze tube to release the cream or ointment. Remove the applicator tip from the tube and wash it in hot, soapy water. Replace the cap on the tube and wash your hands very thoroughly. This again is very important if you want to keep yourself from getting sick. For enemas, have the client or resident lie down on their left side and insert the enema tip into the rectum. Allow all the enema fluid to run into the rectum. See the doctor's order or package directions for instructions on how to use specific enema products. After all procedures, wash hands thoroughly. Steps in using vaginal products. Wash hands. If the medication aid assists the client or resident in the insertion of vaginal products, gloves should be worn. Use the special applicator that comes with the product. Have clients and residents lie on their back with their knees drawn up. Using the applicator, insert medication into the vagina as far as you can without using force. Release the medication by pushing the plunger. Wash the applicator with hot, soapy water and wash hands thoroughly. Starting on task 4.8, assisting clients and residents with inhalation products. The first step is to wash your hands. Shake the inhaler immediately before use. Remove the cap from the mouthpiece. Breathe out, emptying the lungs as completely as possible. Place the mouthpiece fully into the mouth, holding the inhaler upright. Squeeze the inhaler at the same time. Breathe in deeply through the mouth. Hold breath for as long as possible. Remove the inhaler from the mouth and breathe out. Repeat the inhalation process as directed by the doctor's order. Wait 1 to 2 minutes between puffs. Cleanse the inhaler and dry it thoroughly. If using the inhaler for the first time or after a prolonged period of time, test it by spraying the air before spraying it into your mouth. Wash your hands to remove the medication. Next, on to task 4.10, we've got assisting the clients and residents with transdermal patches. Your first step is to wash your hands, like always. Then remove the outer package, being careful not to cut or tear the package. Peel the protective backing to expose the adhesive layer. Place the patch on a clean, dry, and hairless, but not necessarily shaved, area of the body. Do not place the patch on skin that is oily, irritated, cut, or abraded. Select a site according to the doctor's orders or product's instructions. Apply the patch firmly to the skin with the palm or heel of the hand until securely in place. This usually takes about 10 seconds. Patches should be worn for the period of time stated in the product's instructions and according to the doctor's orders, and then it should be removed. Most patches may be worn when showering, bathing, or swimming. Should a patch come off too soon, an attempt may be made to reapply it, or it may be replaced with a fresh patch, the latter being worn for a full time period before it is replaced. Then you'll wash your hands again after applying the patch. Care should be taken not to rub eyes or touch mouth during handling of the patch. Don't touch any of your open bodily parts. It's a good way to get sickness transmitted to you or to get the medicine into your system. And finally, when discarding a used patch, fold the patch in half with the adhesive sides together so that a used patch cannot be mistakenly used again.
4.11. It's talking about the nebulizer. And we actually saw a video on that. I'll go over this very quickly then. A nebulizer is a machine that uses compressed air to make a mist out of medication that's poured into a cup. At the hospitals, they will use just oxygen that comes out of the wall. At home, they have these little machines that are just compressors. They used to be this size back in like early 2000s, the late 90s. They were like this big. And nowadays, they are more like this big. So they've really decreased the size. They're easier to store, handle, and they make them for on the go now. They have battery packs like we saw in the video, or the car for the car plug-in. So they're a little bit easier to use nowadays. Used to, you had to make sure you were at somewhere that had a little bit of electricity to use it. So we are a nebulizer makes the mist. To help the client take the right amount of medication, we're going to help them. So children under the age of 5 years of old, clients have difficulty using handheld inhalers, we'll use them. Clients with severe asthma and clients with asthma attacks. Basically, we're always going to read and follow instructions and doctor's orders. double check the amount of medicine to be used on the client's MAR. Most of the time, it's in a little tube that looks like. You guys ever seen those little tubes of like eye wash stuff, and you just twist the top off, and it's a little plastic container, and you just empty it all in your eye or whatever. They sell them at Walmart, or some of our sterile saline here we have is like in a little container like that. You just twist the top off and let it squeeze in. They're just small. Most of the time, it's one thing full. Most of the time. Open the top of the plastic vial and squeeze the contents into the nebulizer cup with the appropriate amount of the drug. Connect the nebulizer to the mouthpiece. It's recommended for children older than 2 years of age. Use the mouthpiece because it will deliver more medication. On that note, some people have to use a face mask. Connect the nebulizer to the compressor. Have the client sit comfortably in an upright position and ask them to breathe normally. Turn on the compressor and ask the client to breathe calmly and deeply, evenly as possible until no mist is formed in the nebulizer. So it only takes usually 5 to 15 minutes for it to happen. Most of the time, it's in the latter part of 10 to 15 minutes. Ask the client to hold each breath for a second or 2 before breathing out, or take slow, deep breaths as breathing normal, just like. Because the further in it goes and the more it's in there, it's coating the lungs and going into the alveoli and all that. Now, and I think what we're going to talk about now is the care of a nebulizer. So after each use, remove the mask and the mouthpiece and the cup and all that. You can use distilled or sterile water for rinsing. If possible, shake off excess water. Once dry, put the mouthpiece and the T-shaped part and the cup and tubing back together. Run the machine 10 to 20 seconds to dry the inside of the nebulizer. Or you can leave it apart if you can and air dry if you have the means to do so. Disconnect the tubing from the compressor and store the nebulizer in a sealable plastic bag. So one of those big baggies would work, and it'd probably be labeled with their name on it. Place the cover over the compressor to protect it from dust. Every day you should be rinsing it. You can wash the mask or mouthpiece with a mild dishwashing soap and rinse for 30 seconds. Use distilled or sterile water for rinsing if possible. Once dry, put it all back together and run the machine 10 to 20 seconds. Once or twice a week. Now this is a little bit different. You're going to want to take all those parts in and you want to soak it for 30 minutes in a solution that's 1 part distilled white vinegar and 2 parts of distilled water. Throw out the vinegar water solution after use and do not reuse it. Then you're going to want to rinse the nebulizer under warm water for 1 minute and shake off the excess water. Now I'm not talking about the compressor, I'm talking about the little medicine cup mouthpiece and all that. Air dry on a clean cloth on a paper towel or paper towel. And then once dry, you can run it for the 10 to 20 seconds and then put it back away. Is there any questions on that? No? Okay. Then we are moving right along. And most of the time, our clients, they're a little bit more able-bodied and able to do this stuff for themselves. EpiPen. I know we went over those yesterday in a CPR class, but we're just going to hit them real quick. So there's EpiPens and EpiPen Juniors. EpiPen Juniors is a 0.15 milligram dose. It's used for small children for up to about 33 pounds. The EpiPen, it has 0.3 milligrams and is used for adults. Most people think it has adrenaline in it, and it doesn't. It's got epinephrine in it. It's used to open the airway. We use those for respiratory emergencies. Um, if a client is stung by a bee or has a food allergy, and they're going to be prescribed by a physician. We don't just have them. They have to be under prescription. So um, if something like that happens and you don't have an EpiPen and somebody has an allergic reaction, call 911 immediately. Now, if they do have an EpiPen and you use it and you need to use it, call 911 immediately. Because after we give the EpiPen, they are good for 5 or 10 minutes. Most of the time, people get 2 of them. I think you can use 2 doses. That being said, because of the fact they can slip back into the allergic reaction and their airway can be cut back off. So we still, even if they say, oh, I'm fine, I took my EpiPen, I'm fine, they still need to go to the hospital to be evaluated every time. So you're going to wear gloves, and what you're going to do is remove the safety cap. There's a top blue safety cap that will go off the top. Now, when you're injecting an EpiPen, the orange part will go down. Never put your thumb over top of an EpiPen for 2 reasons. If you have it turned the wrong way, you're going to stab yourself in the thumb, and that's not going to help no one. Besides, make you sick, and it's going to hurt. Other reason is when you pull that blue cap off, there is a little air hole right there that safety thing goes down into. When it's pulled out and then you jab it in, it lets the medicine go out, and it has to have air going back in, or it's just creating suction. So never ever jab an EpiPen with your hand like that. Always do it like that. If I had an EpiPen, I would visually show you, but I don't have one. Mine got tore up. So what you're gonna do is essentially grab a piece of the leg there, or either side, and you're going to hit that EpiPen in there. And it usually takes about 5 to 10 seconds to administer, and you'll hear it pop, click. And then when you take it off, take it directly off, not up this way or down this way, because that needle is still out. So directly out, then a sheath is going to come over it and cover the needle. It is sharp, so be careful with it. But that is essentially how you administer an EpiPen in an emergency. And you don't have to take your clothes off. It'll go through pants, it'll go through dress pants, it'll go through shorts, it'll go through their underwear, it'll go through all that. Because it's a good size, thick needle. So it'll penetrate through all this stuff. And that goes with them to the hospital because they need to know what was given to them. So we would send that EpiPen that's empty with them to the hospital. Now, if you're here, always try to grab gloves because you're going to be touching a patient. Remove the safety cap. Hold the EpiPen firmly with the orange tip against the thigh. Do not cover the end of the EpiPen with your thumb. Talk about that. Hold for several seconds, so count to 10, and then call 911. Now, EpiPens should be stored at room temperature. Refrigeration for extended period of time may cause the unit to malfunction. And also, if you have an EpiPen, and we have one here, and we want to check if it's good, well, for one, we're going to check an expiration date. And for two, they usually have a nice little see-through window that looks through the middle of the medication. And if it is nice and clean and clear, then we will go ahead and use it. And if it looks like there's a cloud in there, it's not good. That means that it's gone bad because it's either been left in the car and froze 2 or 3 times, or been in 110-degree weather in there and it's come to a boiling point almost, or something like that. So it's good to look at that medication while we're inspecting it. It can also look brown if the solution is no good inside. Any questions on that? No? Any questions, Tracy?
I'm good.
Okay. So that will lead us up to duty area 5, which